Picture this, it was a sunny Tuesday morning and I was heading to a routine checkup. Little did I know, it was about to turn into an unexpected journey. It wasn't a day that stood out in any particular way. The birds were chirping and the sun was shining brightly, just another day in the life of a health-conscious individual. I had my regular doctor's appointment, nothing more than a routine checkup, or so I thought. The checkup started as usual, with the usual questions about how I was feeling, if there were any changes in my health, and then came the unexpected. My doctor, with a stern yet concerned expression, suggested I consider a colonoscopy. A colonoscopy? The word itself sounded intimidating. It's not something you hear every day, especially when you're not even in your 50s yet. I was taken aback. My heart pounded in my chest like a drum, and my mind was a whirlwind of questions. Why would I need a colonoscopy? Was there something wrong? My doctor, noticing my apprehension, calmly explained that it was a preventive measure. He mentioned that colonoscopies are recommended for people over a certain age, or those with a family history of colorectal cancer. While I was still a few years away from the recommended age, he emphasized the importance of early detection. I was hesitant, I'll admit. The procedure sounded invasive, and the term colonoscopy didn't exactly ease my worries. But my doctor assured me it was a standard procedure, and the benefits far outweighed the discomfort. After a lengthy discussion filled with reassurances and explanations, my initial fears were replaced with understanding, and I agreed to the procedure. It was a decision driven by a mix of curiosity, concern for my health, and trust in my medical advisor. And just like that, I found myself scheduled for a colonoscopy, a procedure I knew very little about. As I left the doctor's office, I was filled with a mixture of curiosity and apprehension. What was colorectal cancer, and why was I being tested for it? Colorectal cancer, also known as bowel cancer, colon cancer, or rectal cancer, is a type of cancer that begins in the colon or rectum. It's the third most common type of cancer in the United States, and the second leading cause of cancer-related deaths. Yet, with early detection and appropriate treatment, colorectal cancer is highly preventable and curable. Risk factors for colorectal cancer include age, with most cases occurring in people aged 50 and older. A family history of colorectal cancer, certain genetic syndromes, a diet low in fiber and high in fat, a sedentary lifestyle, diabetes, obesity, smoking, and heavy alcohol consumption are also risk factors. However, it's essential to note that colorectal cancer can occur in people without these risk factors. So, why is early detection crucial? Well, colorectal cancer often begins as non-cancerous polyps, or abnormal growths, in the colon or rectum. Over time, these polyps can become cancerous. Early detection through screening allows doctors to identify and remove these polyps before they turn into cancer, effectively preventing the disease. Moreover, when colorectal cancer is detected early, the 5-year survival rate is about 90%. However, because symptoms often do not appear until the cancer has advanced, many cases are not diagnosed until later stages, when the survival rate drops significantly. This is why screening for colorectal cancer is so important. Regular screenings can catch the disease in its early stages even before symptoms appear, increasing the chances of successful treatment and survival. I began to understand why my doctor had suggested the procedure, but I was still unsure about what to expect. As I delved deeper into my research, I discovered the power of prevention in fighting colorectal cancer. It was a revelation that was as empowering as it was enlightening. You see, when we think about cancer, we often picture a battle, a fight against an aggressive invader. And while that image isn't entirely incorrect, it's not the full picture. Because before we even get to the battle, there's something else we can do. We can prevent the fight from happening in the first place. Prevention is a powerful weapon. And in the case of colorectal cancer, it's a weapon we can wield with surprising effectiveness. The first step in this is regular screening. Now, I know what you might be thinking. Screenings? Aren't those just for people who are already at risk? Well, not exactly. In fact, everyone above the age of 50, or even younger if you have a family history of colorectal cancer, should get regular screenings. Because here's the thing, colorectal cancer often begins as non-cancerous or benign polyps. These polyps are small clumps of cells that form on the lining of the colon. Over time, some of these polyps can become colon cancers. That's where the magic of screenings comes in. You see, during a screening, doctors can find these polyps and remove them before they have a chance to turn into cancer. It's a bit like finding a weed in your garden and plucking it out before it has a chance to spread. And the most effective method for this screening? It's a procedure called a colonoscopy. A colonoscopy allows doctors to look inside the entire colon and rectum to find these polyps. It's not just about finding cancer. It's about stopping it before it even gets a chance to start. So, as I discovered the power of prevention, I realized that this wasn't just a journey about understanding a diagnosis. It was about understanding how to take control, how to be proactive, and how to make choices today that could safeguard my health tomorrow. I was beginning to see the bigger picture, but I still had questions about the procedure itself. The day of my colonoscopy arrived, and I was armed with knowledge, but still a bit nervous. Let's delve into the details of the colonoscopy procedure. It's important to remember that while the word procedure might sound intimidating, it's actually a routine checkup that millions undergo every year. First things first, preparation is key. The day before the procedure, you'll begin what's known as a bowel prep. This involves a clear liquid diet to ensure your colon is clean for the procedure. You might be asked to take a laxative or use an enema kit, which can sound a bit daunting, but it's all part of making sure the doctor gets a clear view of your colon. Now, let's move on to the day of the procedure. You'll arrive at the hospital or clinic, and after completing some paperwork, you'll change into a gown. The medical team will then guide you onto a bed, where you'll be given a sedative to help you relax and often sleep through the procedure. Next, the colonoscopy itself begins. The doctor will insert a long, flexible tube with a tiny camera attached into your rectum. This tube, known as a colonoscope, allows the doctor to examine the lining of your colon. If they find any polyps or abnormal tissue, they'll remove them right then and there or take a sample for further testing. The procedure typically lasts between 30 minutes to an hour. Once the procedure is over, you'll be taken to a recovery area where the sedative will wear off. You might feel a bit drowsy or bloated, but these feelings will quickly pass. It's important to have someone with you to drive you home, as the sedatives can impair your ability to drive safely for a few hours. In terms of aftercare, most people can return to their normal activities the day after the procedure. You might experience some mild discomfort or see a small amount of blood in your first bowel movement, but these are normal and should not cause alarm. It's also crucial to remember that while a colonoscopy is a highly effective screening tool, it's not infallible. There's a small chance that polyps or cancer could be missed, especially if the bowel prep wasn't completed properly. That's why it's so important to follow the preparation instructions to the letter. So, there you have it, the colonoscopy procedure in a nutshell. It might not be the most pleasant experience, but it's a small price to pay for peace of mind and potentially catching any issues early. In retrospect, the procedure was simple and straightforward, but it was the results that would truly matter. Once the procedure was over, it was a waiting game. Interpreting the results of a colonoscopy can be a little like reading tea leaves. It's not always clear-cut, but there's a lot they can reveal. Let's break it down. First off, the results can show different types of polyps. Polyps are small clumps of cells that form on the lining of the colon. Most polyps are benign, meaning they're not cancerous, but over time, some types can develop into colorectal cancer. There are two main types of polyps, adenomatous and hyperplastic. Adenomatous polyps, or adenomas, are the ones that have the potential to turn cancerous. They're the culprits we're on the lookout for. Hyperplastic polyps, on the other hand, are typically not a risk for developing into cancer. Now, let's talk about what a positive or negative result means. A positive result doesn't necessarily mean you have cancer. It simply means that polyps or other abnormal tissues were found during the colonoscopy. These tissues might be benign, or they could be precancerous or cancerous. The only way to know for sure is through further testing. A negative result, meanwhile, means that no abnormalities were found. This is good news, but it doesn't mean you're off the hook completely. Regular screenings are still essential, as colorectal cancer can develop between screenings. What's important to remember is that early detection is crucial. If a colonoscopy uncovers precancerous polyps, they can often be removed before they have a chance to turn into cancer. This is why regular screenings are so critical. The waiting game after the procedure can be stressful, no doubt about it. The unknown can be scary, but knowledge is power. Understanding what the results can show and what they mean can help alleviate some of that fear. Armed with my results, I felt a sense of relief and empowerment. Because no matter what, I knew I was taking control of my health, and that's a powerful feeling. Knowing my results, I was better equipped to take control of my health. The knowledge that a colonoscopy provides isn't just about dealing with the present, it's about preparing for the future. It's a compass, guiding us towards a healthier lifestyle and potentially saving us from the devastating effects of colorectal cancer. After a colonoscopy, lifestyle changes might be in order, depending on the results. These changes can be as simple as tweaking our diet, incorporating more fiber-rich foods, and reducing red meat and processed foods. Or it could involve more physical activity, as sedentary lifestyle is a significant risk factor for colorectal cancer. Exercise doesn't have to be a chore. It could be a fun activity like dancing, biking, or even a brisk walk in the park. The importance of regular screenings cannot be overstated. Colorectal cancer often begins as small, non-cancerous clumps of cells known as polyps. Over time, these polyps can become cancerous. Regular screenings can help in early detection, when the polyps are still small and before they have a chance to become cancerous. This is the power of prevention. Living a healthier lifestyle goes beyond diet and exercise. It's about being mindful of our bodies, listening to the signals it sends us, and responding appropriately. It's about taking control of stress, getting ample sleep, and maintaining a positive mindset. It's about reducing alcohol consumption and kicking the smoking habit. Remember, every step we take towards a healthier lifestyle, no matter how small, is a step away from the risk of colorectal cancer. We are not passengers in our health journey, we are the drivers. We decide the route we take, and we can always choose the healthier path. Life has a way of throwing curveballs at us, and sometimes these curveballs come in the form of health scares. But every challenge is an opportunity to learn, grow, and become stronger. And so it was with my colonoscopy. And so it can be with yours. My unexpected journey had turned into a powerful learning experience. Looking back, I realized that my colonoscopy was not just a procedure, but a life-changing experience. Often we view medical procedures with fear and trepidation, the unknown looming over us like a storm cloud. Yet it is through these procedures that we gain the power to control our health. This is particularly true for colonoscopies, an essential tool in the fight against colorectal cancer. Let's take a moment to reflect on the journey we've taken together in this video. We started with an unexpected journey, one that led to the demystification of colorectal cancer. We explored the power of prevention, the importance of regular screenings, and the role of colonoscopies in early detection. We delved into the procedure itself, and we sought to understand the results.